Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Mukhammad Junaidi and I'm from State Islamic University of Syarif Hidayatullah, Jakarta. And today I'm going to present my work paper about the policy dynamics of the World Health Organization or WHO on handling COVID-19 in Southeast Asia. The COVID-19 outbreak now has become an international issue that requires more attention in handling because this virus has spread through the world without exception to countries in the Southeast Asia region. The World Health Organization is the organization under the auspices of the United Nations which has an important role in handling disease to outbreak that exists in a country and the world as a whole. The coronavirus or COVID-19 as a dangerous disease that attacks the human respiratory system has now become an international issue. As of August 2020, the number of cases has reached more than 20 million cases worldwide, and it is estimated that they will continue to be found. And then on March, WHO declared that COVID-19 as a global pandemic. Life has changed and economic activities around the world have been disrupted. As in another country, this pandemic is causing real suffering, underscoring the injustice and instability of development. This exacerbates existing risks and raises new challenges, including peace and security, as well as human rights. World Health Organization itself has implemented a health protocol policy, namely physical distancing. However, each country enforces the policy at different levels. Some have imposed a total lockdown of their country by banning all types of activities associated with large crowds. COVID-19 in Southeast Asia. Since the COVID-19 outbreaks spread throughout the country, COVID-19 has now become one of the significant non-traditional security threats in the Southeast Asia region. Both China as a point of emergence of the outbreaks and the countries in the Southeast Asia region that are members of ASEAN emphasize their respective national attitudes and policies. Some policies are cooperative and then tolerant, even selfish to national interest. Whatever policy is taken, it will certainly determine the success or failure of its effort to deal with the outbreak effectively in the region. On August 2020, the total number of cases reached more than 300,000, including cases of death and case of cure. The Philippines and Indonesia are the countries in Southeast Asia with the most case reports. Meanwhile, Thailand, Myanmar, Laos, and Brunei Darussalam were countries with zero reported cases, both new infections and death. Forms of WHO assistance in handling COVID-19 in Southeast Asia. Based on data obtained on April 2020, all Southeast Asia countries that are members of ASEAN have been affected by COVID-19. On January 2020, WHO published a series of advice and technical guidance for all countries and how they can prepare for COVID-19 cases, including how they how to identify and monitor sick people, test suitable samples and track patients, prevent spread and control transmission and health facilities, maintaining supplies and public communication about COVID-19 and the disease it causes. The guide was developed with input from a global network of partners from affected countries and partners with expertise in laboratory, clinical management, infection prevention and control, mathematical modeling, risk communication, and community engagement. With the commencement of COVID-19, the the World Health Organization Health Emergencies Program, or WHE, Southeast Asia Regional Office conducted a rapid national capacity assessment on preparedness for the COVID-19 outbreak among countries in the region. WHE focal point in consultation with national partners are complemented by an assessment template developed by WHO. Based on the gaps identified in the self-assessment by member countries and the top of priorities identified by WHO in meeting its strategic objectives, World Health Organization will focus capacity building and operational support in the following 9 areas. First, surveillance, case investigation and rapid response, point of entry, case management, and etc. Challenges in handling COVID-19 in Southeast Asia. First, the lack of testing seems prevalent in most countries, except perhaps only Singapore. In most of these countries, the lack of testing is due to difficulties in importing test kits, either in terms of access to existing supplies or lack of funding. In some countries, there are allegations that the lack of testing is intentional to mask the true number of infections in their respective country. This may be due to several factors. For example, to avoid just drastic economic impact or to prevent social upheaval. And then second, there's still low confidence in the official data provided by the government. Health experts have warned that false number can foster a false sense of security and helps the virus that causes the deadly disease to spread. And the third, Southeast Asian countries have different health system capabilities. From countries such as Singapore with sophisticated healthcare systems that are trusted by the population, to Cambodia, Indonesia, Laos, and then Myanmar, which all have underfunded public health system. And then the opportunities. WHO as an international organization is an important means of coordinating cooperation between countries and between nations, as well as parties who have an interest in it to achieve that the same goals and need to be pursued jointly. So with this function, World Health Organization has the opportunity to solve this outbreak. Steps that can be taken: first, using technological innovation to fight a pandemic, and then the second is building a regional cooperation through the ASEAN from the response to COVID-19. Okay, maybe that's all for my presentation. I hope it can be beneficial to for us. And then I'm sorry if if there are mistakes during my presentation, thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.